1,273 nurses were surveyed across all 50 states and asked how they feel about the overall state of healthcare, their mental health and well-being, benefits and compensation, and how the government and facilities handled COVID-19.
This morning, the United States is facing a major healthcare problem. 6 in 10 healthcare workers, understandably, say they're burned out.
If you ever ask the question why nurses leave their job, this video is here to shine a light on some of the issues that nurses have been dealing over the last couple of years and some of the reasons why there's a mass exodus of nurses leaving the profession. 43% of the nurses in this survey are considering leaving the healthcare profession in 2021. Comparatively, when these nurses were asked the same question last year in 2020, 80% of these respondents noted that they are likely to continue working in healthcare post-COVID-19. And when they took tenure into consideration, 40% among the least experienced nurses surveyed versus 46% among those with 10 to 19 years of experience were considering leaving the profession. One of the reasons why nurses are leaving the healthcare profession altogether is because their mental health has been drastically affected by the COVID-19 pandemic.
Nobody wants to stop taking care of people. They just don't want to feel horrible while they do it.
Healthcare advocates warn nurse burnout can lead to life or death medical mistakes, including chart errors, administering incorrect doses of medication, even applying medical treatments to the wrong patient.
Nearly 3/4, or 72% of nurses reported that hospital morale has gotten worse in their hospital or healthcare facility since this same time in 2020. And 87% of these nurses mentioned that their hospitals or facilities are still, on average, short-staffed. 53% of these healthcare workers did not feel optimistic about the future in healthcare in the United States. And what's worse is that 83% of these nurses felt like their mental health was impacted after working in healthcare during COVID-19 this past year. Another reason for leaving the profession is because some nurses fear bringing COVID to their family members and making them severely ill through the pandemic. 48% of ICU workers are considering leaving the profession compared to 40% of non-ICU workers. And 69% of ICU workers at the time that this survey was held had been vaccinated compared to 59% of non-ICU workers. Another reason for leaving the profession is because of all the uncertainty we've experienced over the past year. But one of the main reasons why nurses are leaving the profession is because of lack of compensation that they think they deserve. 66% of surveyed nurses rank pay as the most important attribute they plan to look for in a job or a career in the future. 78% of these respondents said that their overall priorities changed in what they will look for in a job or assignment in the future. And nearly 1/3 of these respondents are being compensated less this year than last year. You guys have seen in my previous videos that I've mentioned that we personally know nurses in Stanford University that had their pay cut by 20% at the beginning of the pandemic. But while 32% of these respondents are getting paid less this year than they were last year, nearly half of these nurses are reporting that their hours have increased in 2021, and nearly a quarter, or 21%, are working 10 to 15 hours of overtime per week. Over 1/3 of these respondents, or 36% of them, were extremely dissatisfied with their compensation during the COVID-19 crisis. In another article, it's mentioned that as hospitals have dealt with nursing shortages from burnout, quarantining, staff illnesses, or simply just not enough nurses for patient loads, they have turned to travel nursing to fill these gaps.
It's very tempting to look at what's being offered.
As a former traveling nurse, Samantha Hessing says several companies reach out to her almost every day with offers to send her to hospitals who are in dire need while battling COVID-19.
There's a nursing shortage. That's never gone away. And all that's happening now is these big hospitals are providing enough cash offers to draw a vast majority of the nurses.
Though it's grueling work, the pay is quite good.
I've seen numbers anywhere from $3,600 a week up to almost $8,000 a week. That is with mandatory overtime. So some of those contracts, it is written in that you'll work 48 or 60 hours a week.
There's a huge disparity in pay between staff nurses and travel nurses. For instance, some areas have paid travel nurses in excess of $10,000 per week in areas of critical need. The article goes on to say that a former ICU nurse who quit her $45 an hour staff job to become a travel nurse now earns $120 an hour. And she says that going back to a staff job is just not an option. Another reason why nurses are are leaving the profession is because they feel underappreciated. When COVID-19 first hit the United States, there was word about nurses receiving hazard pay. As I mentioned previously, when you have nurses that are getting their pay cut by 20%, or nurses that work in hospitals in the state of Texas, a state that mandated that nurses are not allowed to quit their jobs, you can now see why so many nurses over the last couple of years feel underappreciated. But if there's any consolation to this story, is that some hospitals are trying to do something about it. For example, the administrators in my department are doing whatever they can to maintain their staff. At the moment, our administrators are being as proactive as possible to hire as many permanent staff as they possibly can. They're coming out to us on a one-to-one basis asking us for our input. They're sending out surveys asking what they can do to improve our working conditions. Our director has been hosting monthly meetings so we can find ways to cope with our physical and mental health. We also have monthly meetings where new issues are brought up and we are asked for our input. Another thing that I should say about the hospital system that I work for, as you guys have seen in my previous videos, is that we are compensated extremely well for the work that we do. So if there's any of you nurses out there that are considering leaving the profession altogether, maybe consider going to a different hospital system or a different state altogether. And if there's any prospective nurses out there that are considering leaving the nursing profession before they become nurses, and if any of you are no longer considering nursing as a profession because of some of the things I mentioned in this video, then think about reconsidering. By 2030, there's going to be a shortage of at least 3.8 million nurses in the United States. By 2029, the need for nurses is projected to grow by 7%, which is faster than the average for all occupations across the United States. So if you need more convincing, make sure you watch my video on how nurses I work with are making at least $20,000 per month, or watch my video on how I worked over 18 days in a row right here.